Welcome to the Feels Club and a new therapy podcast. I'm your host, Mauricio Laguan, or Mo for short. Today's topic is perimenopause and its relationship to mental health. I'm really excited. I'm joined not by one, but two special guests today. The first, you've met her before, Tia Johnson. Welcome to the podcast again. I'm really excited to have you back. We've been here before. Today, you're going to be joining me somewhat of like a co-host role. I'm excited to get into the conversation with our expert for today, which is Dr. Mallorie Cracroft, an OBGYN and integrative women's health expert, founder of Uplift for Her, clinic dedicated to women's health. So excited to have you here today, Dr. Cracroft. Welcome to the podcast.
Thank you so much. I'm excited to be here.
Yeah. Can you tell us a little bit, like what got you into this work? How did you get into this space around women's health? Obviously, you're an OBGYN, so that makes sense, but tell us a little bit more about Uplift for Her and how you got into that.
Yeah, I don't know if I have the most exciting story, but I got into women's health first as an OBGYN. In residency, I knew nothing about OBGYN. Well, rather in med school when we were choosing a residency. And I had kind of my first exposure and just totally fell in love with it. I loved that as an OBGYN, you get to do surgery, you get to work with your hands, but you work with really healthy women too. It's one of the only specialties where women are like happy to come to see you as a doctor. Most people aren't thrilled to go to the doctor in general, but OBs they love. So that it was just a really happy specialty. So I did that for about 10 years and somewhere in there had a baby and found some imbalance in my own life in terms of being an OBGYN and being full-time and not being home and available as much as I needed to. And so I started looking at just alternate career paths and came across integrative and functional medicine and started originally down that road just to hopefully get my own work-life balance a little bit better, but kind of was completely shocked. Like learning about these things that no one had taught me, that you actually can help your body with food and you actually can help your body by working on the foundations of the body instead of just with medications and surgery. I was kind of mad and frustrated that I had to kind of learn this on my own. And I tried to integrate that into my practice just as a regular OBGYN and found it wasn't very compatible, partially because of the delivering babies part. You're kind of in and out of the rooms all the time. Sure. And this type of integrative care really takes depth and relationship and focus and trust, and that's tricky when you're just ducking out of the room all the time. Yeah. Eventually opened Uplift in 2022, and I thought I was opening like an integrative women's health clinic. Yeah. We'll talk about food and we'll talk about sleep and it'll be great, right? And I have been taught so well by my patients. I continue to learn so much about really what the needs of women are. I think I was very naive, as I think most of the medical system is, about what the true women's health experience is like. And I'm continue to be shocked and continued to be educated on really what the needs are that aren't being met. And I am in a position that I get to just adapt constantly and step up to that and say, oh, you're not getting that type. I can give you that type of care. I didn't know, but I can do that. So it's really powerful. Just on the way here, I was talking to I was Marco Poloing with a couple of my sisters about perimenopause. All of my sisters are older than I am and going through perimenopause and menopause. And two of them independently were like, I don't get where the doctors are. Like, I don't understand what I'm supposed to do here. I went to my OBGYN. They couldn't see me for 6 months, but I'm desperate. So I'm really happy. I can't help them very well because they're out of state, but I'm really happy to be able to offer that to people around me to at least say, well, I can do that. I'm happy to do that. I'm happy to hear you and give you the type of care that you need and deserve.
And to bring your background just in full circle, right? Like you have that medical background, you know what that system does, you know where it fails women, and you can bring that together with more holistic care. I was nerding out on your website, Uplift for Her, and I was so fascinated by the list of things that you can talk about. And I started to think about the women in my life and the problems that they've had in approaching even a medical system of like at any stage, from teenagers starting periods to early pregnancy, becoming moms. Like there's so much that happens in a woman's life, and the healthcare system, it's like, well, I don't know what to do. And it's like, well, you know, like at least half of your population is gonna seek this kind of care. Why aren't we meeting that need at all of those different stages? So to see that there is a place, it made me think of people that I'm like, am I going to start sending this website to the women in my life? Because I think it's a really important space to fill, and I'm really glad that you're doing that, as I'm sure your patients are as well. I will say, as someone who doesn't experience periods or menopause or perimenopause, I know these terms because I know women in my life, but I don't know what they really, really mean. So could you like give us a 101? What is perimenopause? Is it different from premenopause and menopause? Like what is the relationship between those terms that are used in that space?
Great question. So premenopause is really wide open. It's anything before your periods go away. So that could be an infant or an adolescent or, 49 and a half. So premenopause is not used a ton because it's not that helpful. Sure. Perimenopause is the transition from, generally speaking, like your childbearing years into your postmenopausal years. Postmenopause is complete absence of periods.
Okay.
So we have these two terms in the middle. Perimenopause is the leading up to that. And we think it can probably be 10 to 15 years long. So I kind of think of it as like the second puberty. You have the first puberty where you go from no periods to periods. And then you have the second puberty where you go from periods to no periods. Did I say that right?
Yeah.
Felt like I said the same thing twice, but I think I got it. So perimenopause is sort of the downward slope of your hormones as you're sort of closing up shop, so to speak.
Okay.
And then menopause is literally one day. So it's one day of your life that is the pause in periods. So once you hit 365 days of no periods, you are in menopause. And after that, you're postmenopause. Okay. So it's a really kind of silly terminology, but that's the general idea.
Yeah. But honestly helpful. Again, like I at least, and maybe it's because I'm not in a woman's body, but like I've heard these terms, but like to hear it explained so plainly. Obviously, at Anew, we focus on mental health. So the intersection of perimenopause and mental health is what we want to discuss with you today. So when you think about perimenopause, that transition phase of period to no period, what are some of those symptoms that start to bleed into the mental health of it all? Are those some of the first symptoms you see in perimenopause? Like you're talking hormonal shifts, and I know hormones have a lot to do with how we experience our moods every day. Our hormones are affecting all of that. So can you tell us a little bit more about that?
Yeah, I think first, just a shout out to women. Like it's kind of not fair. When you think about men's mental health, it's so steady. And women, we start going through crap, from puberty, our hormones and our brains kind of go a little crazy. Yeah. And then you think you get to a sweet spot and then you decide, well, but I might become sexually active and I don't want to have a baby. So I have to use hormones mostly to keep from getting pregnant, which messes with my mental health potentially. And then you decide, okay, I'm done with birth control, but I want to have a baby, which can mess with my mental health. So then I decide I'm done with the baby and I'm postpartum. Again,
mental health.
Huge mental health issues. And then you decide, okay, I made it. I'm done having babies. And then you get hit upside the head again by perimenopause. You think like, okay, I'm finally in the stable part of my life.
Sure, yeah.
And it goes bonkers. Like talk about a roller coaster. When those hormones really start becoming erratic, the mental health concerns can be big and serious and unpredictable, which is probably the most frustrating part. As women, we're pretty adaptable, right? So if you can give us a series of days that are the same, we'll figure out a way to deal with it. But that's really the trick with perimenopause is that it's different. And as soon as you think that you've got it figured out, it can change again. Eventually, you do get to postmenopause and you get this like stability of like, finally, my hormones are at least the same day to day. And that's when I think the first glimpse at stable mental health experience that women get. So just a moment of silence for women and the struggle that we have with this combination of hormones and mental health. But more so to your question, in perimenopause, our hormones cycle always. As soon as we hit puberty, our hormones go through hopefully a monthly cycle.
Yep.
When we get to perimenopause, that can start to become a little erratic. And the first thing that happens is our progesterone hormone starts to go down a little bit. As the progesterone hormone starts to go down, that feels more like anxious. That feels irritable and anxiety, can't sleep at night. So we see a lot of increase in anxiety in the first part of perimenopause. That can be mid to late 30s, early 40s, and anywhere after that. But But that's really the first thing that we typically see. The estrogen actually will start to go up at first, which can make you feel more emotional. Think pregnancy, like I'm crying at commercials, like not depressed, but like I feel weird. Like I feel like everyone around me is like not right. I'm kind of bugged by my husband. He's breathing too loudly. He rolled over in bed just as I was falling asleep and woke me up. Like it's this combination of like irritable, but very what we call hormonal, which I think a lot of women can identify with, but emotionful, you know?
Yeah.
The next stage of perimenopause, the estrogen starts to fall. And that's where we see a lot of actually depressed mood, low mood. It can feel like fatigue, but it's like a combination of energy fatigue and brain fatigue and life fatigue. Like everything feels heavy. Everything feels hard or empty. And I think the most frustrating part of all of this is it's really difficult to, and this is true with mental health in general, as you know, with mental health, it's like I tell patients, it's like you're looking at the world through a set of lenses that you didn't know you put on. So you don't realize what's real and what's not real. Like to you, your husband is super obnoxious and that's his fault and he should stop it. And we kind of joke about it, but if you've been through it, it's actually kind of heartbreaking because you can't tell.
Yeah.
You can't tell when the world is being annoying or when the world really is so awful and when it's in your head or in your hormones or in your perception. And that I think is, we have to laugh about it because otherwise, you know, we'll just go crazy. But that's, I think, the most maddening part of this and where people come to me actually pretty discouraged of like, I don't even know what to do anymore. I don't know what's what. I don't know how to respond. I can't control my emotions. And so it's really, when you ask like, what are the mental health issues around perimenopause? It's this state of kind of chaos and discouragement and sometimes hopelessness because you lose track of what's you know?
That's the amount of empathy that's like growing in me, hearing you speak about the experience that a lot of women are going through. I don't know. I want to ask you like how we can better support women, which the list I'm sure is very long. But I'm curious for you, Tia, before we get into supporting women going through this, you obviously see patients for mental health care, specifically at ANEW. What have you been seeing around women in these age ranges that Dr. Cracroft is talking to us about and their mental health status? And like, what are some of those patterns that you're seeing of all, you know, and taking the science of it all with these hormonal changes that are happening? What do you see?
That's a great question. The confusion, I think, is number one. This isn't me. This doesn't feel like me. I've never been this way before. A lot of what you joked about my husband, I love my husband, but now I'm frustrated with XYZ all the time. And then trying to make sense of where is this coming from? Why am I experiencing this? Is it my hormones? Is it depression, anxiety? I've never experienced that before. And then trying to figure out, is this a wave? Is it kind of fluctuating up and down? Or is this something that maybe has been underlying for some time now and is just kind of, you know, come to the surface? Question for you, Dr. Cracroft. Knowing that this is, well, let me back up. I feel like life goes so fast. And I always joke about, no one told me, you know, how fast I'm going to get gray hair or these things that when you're young and all of a sudden you're like, this happens now? I'm wrinkling at like 20, you know, it sneaks up. How can we do a better job of preparing for the unknown, but yet the known of these transitions that we're all experiencing at some phase?
It's a great question, and it's complex and it's long. I think some of it has to do with understanding yourself. I think of perimenopause, the hormones start to deplete a little bit, and as those hormones go away, we lose our buffer, or like you think about bowling, the bumpers that kind of keep us in the middle. That's what those hormones do. They make our bodies pretty forgiving. And that's why when we're in our 20s and you go out partying one night, the next day you sleep in, you kind of are okay after that. And any perimenopausal woman would be like, oh no, like that would set me back for weeks. The body is very unforgiving in this stage because that's what those hormones do. So some of it is just recognizing that in your earlier years and recognizing as you age, you're going to have to do things differently. I hear that more than anything. I'm doing everything the same. Why is my body different? Like, because it is. So you have to do things. You have to learn how to adapt with your body. Same thing, right? You're not doing the same thing you were at 10 years old or 15 years old or 25. you got to go with the flow a little bit. And so that's a big part of it, is understanding yourself, what your lifestyle is. I think also the better care we take of ourselves when we're younger, it really plays out, because those hormones are that buffer. The more buffer you need, the worse you're going to be off. So if you're living a lifestyle that is pro-inflammatory, like not enough sleep, too much stress, under eating, not enough fruits and vegetables that are nature's anti-inflammatory elements, right? The more that you're doing that through your teen years and your 20s and your 30s, the more you're going to struggle as you get into the perimenopausal years. So take good care of our bodies, always. Always we should take good care of our bodies. Now we have to have some grace. I don't take perfect care of my body, so we all do the best we can. Yeah. And I do think the body is actually pretty forgiving, but it's not ultra. It can only take the messages we're giving it. So we have to take good care of our bodies. I think another big portion too is you really want to understand your mental health. So perimenopause can trigger or bring to light underlying mental health issues. If you're prone to depression, it could get worse. If you're prone to anxiety, it could get worse. If you're prone to ADHD, or I don't know if you're prone to ADHD, but if you have an ADHD brain, it can go really haywire in perimenopause. And the more we understand your brain ahead of time, the more we can act in the earlier days of perimenopause instead of waiting until you really are in this state of chaos. So I guess I would say don't put it off. Understand what may be coming and understand how to take care of your body all along the way. Find a professional who can support you. But I want to counter myself a little bit, because so much of the perimenopause and menopause conversation right now kind of feels like doomsday. Like, once you hit 35, it's all downhill. Like you are basically doomed to suffer. And I really don't believe that. And I actually don't like that narrative, this idea that like, once we hit perimenopause, life sucks. Like, I don't like that. I don't like that conversation. I'm an optimist. Yeah. I want to be happy. I want people to know how to support their bodies. And we can, but it does take a little more proactivity. You don't get away with much. So you really have to be conscientious about, I will feed my body. I will rest my body. I will recover my body. I may have to get rid of things that I could tolerate in my life, like being overworked or, have a job that was toxic. Like I can get away with that for a while. You can get away with it once you hit your 40s-ish. And I will say part of that is hormonal because of perimenopause, but also part of it is we get fed up in our 40s, and our bodies do too. And I actually think that's where the beauty of perimenopause comes in, is we have to get to a different level of maturity of like, I'm not doing this anymore. Totally. I'm not just going to say, okay, I'm not just going to put myself on the altar for everyone to stomp on. Like, I know who I am now. Yep. I'm in my 40s, and 50s. I know who I am. And there's such power and such beauty in that. And the more that we step into that, the better our mental health will be, the better our hormonal transition will be. The problem comes when people try to keep everything the same in spite of the hormonal fluctuations. Sure. And I don't think that's the way nature intended it. I think it's meant to be this moment of like, oh crap, okay, let's change things. Let's get to know ourselves.
I love that message, that it isn't doomsday. Mm-mm. It can feel doomsday. And I say that as someone, I'm just thinking about this morning, my wonderful wife who is in that, I'm not going to diagnose her with perimenopause, but she's in that age range. She just turned 37, 38. Bad that I can't remember now. And her birthday was like a few weeks ago. But I mean, I've been going through it at home where I'm seeing some of the things that you're discussing, like periods look different than they did a few years ago even. Like all of these things are just so real. And it does, as someone who lives in the home with someone and I'm seeing her go through this journey, it feels doomsday. Mm-hmm. I think it's very easy to be like, who am I? What's going on? Yeah. Why do I feel this? I hate my children. She doesn't hate her children. But that feeling, or like, you're annoying me. I think she literally said to me this morning, you're so annoying. Like, stop it. When you were talking about the glasses and not being able to like understand what's real or like what's the hormones, like it's helping me as a partner to her to be like, I need to check myself before I keep, feeding this narrative of it's chaotic and it's not good. And it's like, going to be this tornado that we're going to have to navigate. But the reality is that like we can take care of it. We can get in front of it. I think one of the things that stands out to me that you're sharing, and it's so beautiful, is that I have been very encouraging of her to just like, and it's been very easy actually to encourage her to like just stand her ground, whether it's at work or setting boundaries with friends or with family. She's been all for it, which like in our earlier years, we've been together for about 10 years. So like in her 20s, that wasn't necessarily her. She was always like, oh, like, yeah, like it's okay. Like I'm going to give them grace. But like recently it's been like, no, that's not my mojo. That's not what I'm looking for in life. And so I'm not going to. That part I love because I think in society, the message we sometimes give women is like, no, you're mom, you're caregiver, you're loving, you're all of these things, which means that you come second and everyone else comes first. And this transition that she's been having in her life of like, no, I can actually be first. And even first before me, right? Like my needs don't come before her needs, which is something that I love and I want her to have that. I just think it's so wonderful that you could even start to like blame perimenopause as like the phase in your life where you start to transition. I am number one in my life for me and I can take care of me. And even talking about how you eat, when you sleep, when you rest, like that reclamation of those things. And saying like, I actually am going to keep that for me because that's what my body needs. That's what my brain needs. That's what my health needs. And I'm going to do it. And I'm going to be unapologetic about it. Like we should do that to women more.
Absolutely. And I think sometimes when we get into this, it sounds like this transformation is meant to be kind of this like power woman, like back off, like stop getting in my way. And I do think for some women it is that, but it doesn't have to be. It can be the phase that you become the warmest, most empathetic, most service oriented. Like it can be whatever you want it to be. For me, it's been stepping into this state of abundance, which sounds pretty out there, but I'm pretty out there, so it's fine. I think it's this idea of I don't want to be held back by anything like old coping skills, old thought patterns. Like that for me is the shedding. So for me, it's not so much like I said no, and you're not gonna, and for or people anger, that's right. Sure. Like, anger. No, it's this stepping into myself that I think is going to serve me and my family better. I'll be able to show up in the world better. And that's when I get a little emotional in this space because we need women to be their best selves. The world is so hard. Like these wise women starting in their mid 30s, they're some of us have babies later, but stereotypically speaking, like they've sort of had babies, their kids are growing up, and this is the phase that they are wise. They've been through a lot, and they're just going to get wiser and wiser, stronger, more knowledgeable, more skilled. We need women in this phase to be functional and to be able to go out there and be their really best selves. And so for me, it's that type of shedding of, yes, I'm going to put myself first, but it doesn't necessarily, I think some people that triggers because they're like, well, I don't need to go get a pedicure. I want to go serve. Great. Do that. Do that. But shed the stuff that's not serving you anymore and step into that truest version of yourself. It's so beautiful.
I love that distinction because it is, and I hope I didn't come across as like I'm married to like this angry person.
No, not at all.
Because I'm not. I love that reclamation, and every person's different, right? Like maybe you were that person pre-perimenopause, but what you're saying is like, I love the word abundance. Like I think that's and joy and like those words just resonate so much in my personal stage of life of just leaning into that, and that could look different. Yeah. And to your point, I don't think I've ever seen her be a better mom than the person that she's becoming through this phase of her life of just. Her putting herself first means that she shows up better for her kids. Yeah. She shows up better for work. And she works with kids at work too. So it's like, the benefits that it's such a great framing. And I'm so grateful for, if anything, for that framing that you just offered me of like, it's not the doom and gloom. It's actually a reframing of like, what does this new stage look like? And
it doesn't really fit anymore.
I love that.
I'm just getting sucked into the beauty of all this, but I forgot I'm co-hosting. But what really comes to mind with what you both just shared is the self-awareness, the level of self-awareness of women, and then being able to act upon that, reflect on where you've been and where you want to go. And I have to applaud you for your self-awareness and just the ability to kind of help through a hard transition time and recognizing that and giving not only yourself grace in learning, but also your wife, and then calling out the beautiful side of things, because I think it really does have this scary, this is what's next in your lives. Ooh, good luck. It doesn't need to be that way. Again, the self-awareness, there's so much beauty even in that piece. Going back to just the unknown of, again, the known, how do we make that less scary and more just common knowledge so that it can be a more comfortable topic or a comfortable transition, I guess we can call it?
Yeah, and this is where I do actually love the dialogue happening in the world about menopause. Like I say, I don't agree with the pressure that it feels, the negative connotation it has with it, but I'm glad people are talking about it. You get a woman who's now in their late 30s, before they just would have thought that, like, I'm just not a good person, or I'm just irritable, or my husband's changed or whatever. And now hopefully it's coming to their mind of like, could this be hormonal? Like, is there some help I could get? And that's where my clinic comes in. That's what we do is, as hormonal experts, we can really help match the symptom to the hormone level. We can do blood work and we can do testing, but honestly, someone who does this all day, every day, that's where I can talk to a woman and be like, I think I know what's going on with your hormones based on what you're saying. And we can start adding back hormones when we need to. We can talk about ways to support the body to produce more of its own hormones. So there's a role for medicine in here too, to be able to help women through this transition. And the first step of that is awareness. Like, this kind of feels like what everyone's been talking about. Let me go ask some questions.
What are some of the other things that, like, I hope there are people listening to this and like, whoa, is this me? Like, that other ways that they can self-advocate? Like, what should they be going to their doctors with? What can they start doing at home? Like, what are some of the things that you are recommending folks to start doing to advocate for their health, mental health, physical health, all of it?
I think the first thing is you be the expert of you. Like, a lot of patients will come used to the conventional medical model, and they'll come and be like, here, fix me, like take everything I've given you. And I'm happy to do that, but it's not as effective. What's really effective is if a woman is tracking her cycles and she's tracking her symptoms. It is so powerful to come to me and say, show me your calendar and say, on these days I feel this way, and on these days I feel this way. I can interpret that so much better, and I can help you get to the bottom of it. I do a lot of mental health support, and some of it is trying to figure out how much of that is hormonal versus other things. There's other reasons for our brains to not function the way we want them to. Nutrient deficiencies, inflammation, sleep deprivation. And if I understand where your symptoms are in a cycle, it's way easier for me to get that right the first time or the second time, instead of just throwing darts at a dartboard and hoping one sticks. So be the expert on you. Track your cycles. Track everything you can find about your cycles. So we talk about cervical mucus tracking. We talk about temperature tracking. We talk about symptom tracking. Like, know your cycles. It's going to keep changing, but understand where your symptoms are with the cycles. And then I can do my job so much better.
That's cool.
I also think that sometimes working with your partner or your spouse can be helpful, and sometimes not. Sadly, I think a lot of partners will hold hormonal changes against women. Like, well, that's just PMS. And it's like, no, you are being a jerk. Like, that's on you. And it can be really difficult to have that conversation for some partners. So I do add that caution in. If you don't have a partner that you can have that supportive conversation in, that I'm about to tell you about, then I might not go there. But if you do have a supportive partner, I think it's helpful to start saying, like, do you know what? I think my mood is fluctuating with my cycle. Would you mind tracking with me? Would you mind gently helping me understand? Because I don't feel like I'm perceiving the world completely accurately at this point. Can you help me understand if I'm overreacting? Now, you see why you have to be careful here, because if you don't have a lot of trust, or you don't have a really great relationship with your partner, they can totally use that against you. And we don't want that for anyone. But if you do have a partner like yourself that feels like, sweetie, you might be blowing that out of proportion just a little bit. I noticed you might be in your luteal phase or the days leading up to your period. if I'm being a jerk, like you tell me and I will change that.
Yep.
But I just want to point out that a week ago, this didn't bother you. Like you have to be so gentle because our poor brains our brains just may not take that so well. So you also might wait until after the period and say, hey, I wanted to point out that I've noticed maybe some progesterone might be helpful. Let's maybe get you an appointment so we could get you some support because I want you to be happy all the time. Like I think a supportive spouse can play a really good role there. But it's so funny
that you say
that. It's tricky.
It is very tricky. As someone, the first example that came to my mind, my wife loves to prepare our kids' lunches for school. And she'll like on like a regular day, like, oh, I just love that I get to do this for them. Like, this is so fun. Like she like puts all these things into it. But there is that one time during the month where like all of a sudden she's like, I hate making their lunches. And like, I noticed this maybe sometime in the last 6 months, probably 6 months ago. And I was just like, you love this. All of a sudden you hate it. And I think my suggestion last month or 2 months ago was like, hey, when you start to feel like lunches are the worst thing in the world, pass it off. Like, I'm happy to make the lunch. Like, just tell me make the lunch. And this month in her cycle, like that's been our go-to. She's like, remember how you told me that you could make the lunches? I was like, yeah, like absolutely. And she's like, it's time.
You're getting bonus points in recording this episode. Like, that's well done.
I will say though, I'm not the best because I think and this is just my personality. Like I tend to, when things start to feel very stressful for her, I tend to just make light of things because it's my coping mechanism.
Don't do that.
I know. And that's what I'm learning.
Not
like,
in PMS.
Not in PMS. Like I make light of things. I'm like, oh, that's so silly. Like, haha, there it is. And like, it comes from a place of like wanting to make things lighter.
Totally.
But what I'm hearing from you, and I think what my wife is going to appreciate from you telling me this is like, that's not the moment to do that.
The brain is just a different beast at that time. And this is where I actually have so much sympathy for women is because it's like we talk about PMS and we kind of laugh about it, but it is so disempowering. Like we as women like to have control over our lives and like, you want me to get it done? I'll get it done. Like you want me to go do that? I'll do it. And there is this hormonal fluctuation that changes us into different people. And like, as much as we laugh about that, can you imagine as a man, if 1 week out of the month, that is 25% of your life, essentially, you are a different human. You suddenly see the world differently. You can't think clearly. Everything is annoying. It's super unfair. Now, I will shout out to progesterone because it makes a massive difference. So if this is you and you're like, oh my gosh, I eat any age, like in your 20s, if that week before your period is crap, progesterone helps so much. And it's a prescription and it's safe and it's cheap and it's easy. But just like, I just want to really have that language there because I'm glad we laugh about it and we should make light of it. Absolutely. But I just want to be sympathetic. Like it's super annoying that we turn into a different person sometimes. Yeah. I will also say from more of an integrative and functional approach, we should be able to get that better even without progesterone. That's a sign of not making adequate progesterone. Perimenopause is a little bit different, but like there are things you can do to smooth out that transition. And when a woman is at her very healthiest self, what I say is your period should sneak up on you. Like it shouldn't sneak up on you because it should happen exactly on time, but like you shouldn't even notice that it's coming. And that was my experience through my own health journey is I didn't think I had PMS until I started dating my husband and he was like, I think, and I was like, no one else has ever told me I had PMS. And yes, I did have very bad PMS. I never knew. But as I got through my own health journey, he might disagree. He might be like, no, you still have PMS. But it's better. It's so much better. And the pain, like no cramping with periods and not heavy bleeding, like that really should be the goal. So there's lots of ways to support the body naturally to do that. But if all else fails, progesterone's a magical thing.
That's amazing. Okay. Noted.
Yeah.
And I think one of the other things, and going back to the question I wanted to ask you earlier, how else we can support, whether it's your partner, your mom, your sister, your aunt, your girlfriend, like how can people better support women as they're going through these phases of life?
Can I add a twist to the question? To further, I selfishly support other providers, but also spouses or those in everyone's life is my question is, when I'm kind of going back 2 topics, but tracking symptoms, tracking periods, how do you then also encourage the support system? Not only, hey, kind of looking back on the last week, let's consider getting you in, progesterone could be helpful, and I'm talking as a spouse, but then how do you also add to that, maybe it's not hormonal, maybe there's more. How do you also encourage those types of conversations alongside Mo's question? Again, I'm selfishly asking this as a provider too, right? Because there's just so many layers of missed opportunity, I think, in women's lives.
It's a great question. I think that from your question, Tia, as a practitioner, if it's a mixed picture of mental health, I'm going to start with hormones 100% of the time. One, because they're super safe. They don't have as many side effects. They're more mimicking the natural physiology. Mm-hmm. And I tell patients, I can't tell how much is hormonal really until we fix the hormones. And some people will get all the way better. Then it was hormonal. Some people will get 10% better. Then it wasn't hormonal. And also a shout out for a clinic like mine, that there are so many pop-up hormone shops now that are like hormone clinics. And to a hormone clinic, everything looks like a hormone. And so I see a lot of patients who will go to hormone clinics, but that's all they do. And so they just go higher on the dose. Like, oh, we didn't fix you yet. Must be more of a hormone problem. Yeah. And so I get patients who are like, they kept messing with stuff. I was on super high doses, messed with my periods, and I still don't feel any better. At some point, it's not hormonal. And so what I personally do is I think I can understand pretty well how much is hormonal based on a full picture, but that takes time. I have to really understand. And the more information you give me, the better I can map it out. But once I've gotten their hormones pretty well adjusted, which can take 1 to 3-ish months, if someone's no better, then that's where I'm kind of readjusting the conversation to say, how's your brain doing? And I really try to leave it that way, because when we say mental health, which I do say, but it can feel like we're trying to put a label on it, or we're trying to label it. Like, the point is my brain isn't working like I want it to. And that's what we want to focus on: nutrients and inflammation and sleep and, all of the things that brains need to work optimally. Yeah. That's then where I'm going to that next layer of supporting the brain. And sometimes that's medications. I think things like ketamine-assisted therapy can be so powerful, because when we're deep, deep, deep in a groove, we try the hormones. The hormones help some, but then we're still stuck in these thought patterns and stuck in this deep groove. Yes. That's where something like ketamine can sort of like lift you up and shift you over and put you back down. So it's a long conversation, but I typically start with hormones first, especially if the picture matches. Like, if someone says, I've had these symptoms for the last 20 years, it might not be PMS or perimenopause. If it's cyclic, then yeah, it's hormonal, at least in part. So the history can help me really understand how much of this might be hormonal. So to answer your question, like, they need to see a specialist. They need to see someone who can really have this detailed conversation, that they can just like vent all of their feelings, and I can help them put them in little boxes and categories and help make sense of it. I think in terms of supporting a woman in general, I will say it's tricky. I do think it's tricky. I think having a lot of grace for these fluctuations of, like, I can imagine my own husband, but other people too, other spouses who are like, big eyes, like,
what's going on?
Yeah, that is not the same person that you've been. And so much compassion, to have so much compassion for that, and to say it in a way that speaks for optimism and hope of like, honey, like, you are such a happy human. And the last little bit, I've noticed that you don't quite seem like yourself. And I want to say that I want to be a safe space for you, because I don't want you to change. I want you to feel good. Do you feel good? Instead of saying like, I've noticed you've been a total jerk. Like, no one wants to hear that. I think even though we're normalizing the perimenopause conversation, there still can be a lot of shame and guilt around like, who am I? Like, what is this person I'm turning into? And that needs so much safety to be able to let down the guard enough to be like, I don't know if this is you. Like, this could be something in your body that's going awry. So I think supporting in that way, maybe just throwing out the idea of like, hey, you know what? I was listening to a podcast about perimenopause. You're kind of in that age group. I've kind of noticed that you maybe don't feel your best, instead of you're being a jerk. Like, I've kind of noticed that I don't know if you feel your best. Does that resonate with you? Do you want to talk about it? If they say no, great. I'll ask again after your period. You know, like don't ask in the luteal phase. That's the phase leading up to the period. Just put them to bed, cover them with a weighted blanket, like eye mask over the eyes, give them chocolate and like electrolytes and like leave them alone. But in the follicular phase, when they're feeling go get them, maybe reflect on the last couple weeks would be the best way to support.
That's really good. I inadvertently did that. I tried the other version.
It doesn't work.
It does not work, and it becomes a very messy conversation. And your intentions might come from a really good place, which is where I felt like I was coming from, but it just doesn't land the right way. And I think that's really important. Like, hey, like sometimes the conversation just needs to wait. Yeah, doesn't need to have to. It doesn't have to happen when it's happening. Yeah. It can take a pause, and you can revisit the conversation.
And I'll say too, like educating a woman, if they're not educated, this doesn't always come well from a man necessarily, but like the more that a woman can understand about perimenopause and just be, Tia, you were saying like the unknown, right? Knowing that the unknown is coming. I think that's actually huge. Like start listening. Hopefully this podcasts like this are helpful to be like, okay, I'm 25, but I'm going to watch for this. And if I start feeling not like myself, this is the beauty of having these conversations, that it wasn't happening 20 years ago. So these women would be going through this in isolation, feeling literally like they were losing their minds or that they were losing themselves. And we don't have to do that anymore. So hopefully just more conversations, people know what to look for.
It makes me think of like even intergenerational conversations, right? It might be difficult for someone of another generation to talk about their past experience with all of this. But where you can, I like women supporting women, right?
Absolutely.
Like, and leaning into and saying like, hey, what was this like for you? What were you like at 37, 38, in your early 40s? Like being able to have those conversations, I think can also be very powerful and very liberating and also grounding to like, I'm not going cuckoo for Cocoa Puffs. Like I'm like, this is something that's happened to women in my life, to women in my family. And I think that's like a really important phase of it too.
And we don't need to be ashamed. You don't need to feel guilty, but you probably do need help. Yeah.
And it's okay to need help.
Yeah. Yeah.
And maybe it's just a theme of the women in my life, but sometimes even doing that sounds sometimes difficult to be able to say like, I need help. And I'm a big proponent. Like we all need help. And I say that as someone who also doesn't like asking for help, that asking for help can be a really big like boulder to overcome, obstacle to overcome. But when you do reach out and ask for help, like it's there.
And I think it's helpful to understand that sometimes the help you need is biology related. You know, I think a lot of us have a shame around asking for a therapist, hopefully less now, but or like seeking antidepressants or things like that. But understanding that, oh, my hormones are different and I could support them. I think hopefully that's an easier barrier and often is all we need. But then I can help have the conversation if we are turning to other support for mental health, that I can sort of gradually get to that point. And I also want to bring attention to the idea of the phase of perimenopause. It's not just a hormonal transition. It's a big deal. Like you think of what women are going through and men for that matter, in their 40s and 50s. It's a very big life transition. Oftentimes our kids are teenagers and are struggling. Oftentimes they're moving out of the house and having stresses of their own. Oftentimes we may start having health problems between ourselves and our spouse. Oftentimes our parents are aging and starting to have really serious health problems or reaching the end of their lives. Oftentimes our careers are in a state of flux at this point in our lives. It's a big life transition. And so you add to that the taking away of hormones, that buffering, everything gets bigger. And it really can cause an imbalance, you know, where you think like of a scale tipping and you're like, I'm keeping it balanced. It can, and then all of a everything like, all at once can feel like it just tips. And that's where sometimes therapy is really necessary to say like, what is happening in my life right now? Like, I don't feel like I recognize my life or myself. That's legitimate. Like oftentimes we don't give ourselves credit for the amount of hard things we're going through at that stage.
What I'm hearing you say is that like this perimenopause hormonal shifts isn't happening in a vacuum.
Exactly.
It's happening in life.
It's not just biology, but it's in large part biology.
A large part biology, which makes me think for you, Tia, like when you see the patients at ANU, patients that you've seen in your career, what does that integration look like? Like what does, and I say integration, like the mental health of it all, right? Like the talking to a therapist, the seeking ketamine assisted therapy or other medications to help with mental health. Like what have you noticed around the mental health treatment of it all?
Yeah, I always ask patients about their support system. What does that look like? And every once in a while, people will say, well, I've got this really supportive spouse in my life, but they don't support me in the way I need, which is hard because I think sometimes, being a woman, you're getting that support and you're like, thanks for the support, but I don't want it like that. And they're like, well, how do you want it? I don't know, but not like that. Mm-hmm. But you don't know yourself. So even being self-aware, that's a hard thing to communicate, especially when you don't have any idea the way to, right? Just some of those things, you're like, yeah, that actually sounds nice. But without it being presented to you in that way, you may have no idea. Mm-hmm. So when patients are coming in, I think it's even more of this question mark where you're like, well, I've done okay without medications, but maybe that's where I'm at. Or talk therapy, absolutely, right? If you do need that additional support, or just being able to better understand yourself and what you're feeling, in addition to all of these biological things that are going on. It's like, well, that explains it, but life is not going to stop happening around all of that. So how are you going to manage all of that at the same time when everything, what did you just say, right? Yeah. There's no longer balance, which we can do a good job of this for most parts of life, but every once in a while it does shift. And there's additional support needed, whether it be therapy, medication, hormonal therapy, or all of the above.
Just know there's help.
There is help, yes. And it can look different for everyone.
Yeah. And I think getting into that driver's seat is also what I'm like understanding from both of you, like knowing yourself, knowing your own data, right? Like knowing your mood fluctuations, days of the month, all of that stuff. But then also knowing your history, knowing what is the support system I have, where is it working, where is it not working? And then getting into that driver's seat and saying, I'm going to go to Uplift for her for this. I'm going to go to a new therapy for treatment, mental health treatment, ketamine assisted therapy, like whatever it might look like to get into that seat and say, I can drive this car to where I needed to go to help me.
Yeah, it's in our clinic. One of the things we do too is when we do annual exams, so just annual checkups. As in my old practice as a gynecologist, that would be like a pap smear and a physical exam and a lipid panel and like, you good? Okay, bye, right? Mm-hmm. And I'm glad that people still do that. But one of the things we get to do in our current clinic is we do a review of like, what are your lifestyle habits? Any big things coming up that then we can help someone identify and flag sooner because we're now seeing them every year. And I think in a perfect world, that should be the annual exam is like a true like wellness check-in of like, but really, how are you? Not how is your cholesterol, although that's part of it, right? But like, how are you? How are you feeling day to day? How is your energy? And when we have those conversations, sometimes that's when people are like, ooh, actually, now that you say that, like, it's been rough, but I've just been powering through. And so I never stopped to take care of myself because I had to get things done. So just establishing care, I think an annual check-in, even if it's an annual check-in with like your sister, like you plan a weekend retreat once a year and you go and you just talk through things. That sounds amazing. Actually, I should do that. But that's sort of just set it on the calendar as some sort of time for introspection, even every 6 months of like, what's different, what's new, especially as we get to these life transitions of like 35 and above, I would say, to have that time set aside to be like, but what do I want? How are things? Like, what kind of support do I need? Otherwise, we just power straight through. We don't take the time to think about it.
That resonates with me so much. And I actually, these last few years, friendship has kind of like taken that. I love aging. I love like my brain maturing and like just seeing the world for what it's worth and for like just differently. But like friendship has even taken that seat for me as a man, not going through perimenopause, like what friendship can look like. And like those check-ins that you just mentioned, like being able to take a pause and take an inventory of your life is what I call it, of just like, where am I struggling? Where's my career? And like, what's the next step I want to take? Like, how am I doing as a parent? Like, how am I doing as a partner? Like, how is my mental health? Am I taking the moment to pause and see like, am I okay? Or am I just powering through? I don't know. I'm repeating what you're saying basically, but I think that like moment, and I think the more we can do that for ourselves, for each other, encouraging, like I'm about to suggest that girls trip for my wife to be like, let's, and she's kind of done it with some of her friends inadvertently, but like to be intentional about it.
Set it every year.
Yeah. and say, like,
I'm going to create it, and we'll do like a lab panel before you go, and then we'll have weighted blankets and large bowls of chocolate, and also journals to get all done in one fell swoop. Just do that yearly introspection.
Oh,
That's beautiful.
I see it in a cabin in the mountains.
Yeah, right?
I guess I'll go.
Yeah.
Like, shoot, can I come?
But your husband books it for you.
Yes.
He clears your schedule, takes care of the kids.
That's right. Yeah.
Books you a trip.
Okay, I noted.
There you go.
Taking notes for what I have to do when I get home. We asked some of our patients, our viewers, some FAQs, like, what questions do you have? So I have some like quick hitters, like,
sure,
like 1-word answers. Would love to kind of like go through these and see what both of you have to say around some of these. So the first one is, can perimenopause cause depression even if I've never had depression before?
It can cause depression symptoms for sure. Yeah.
Why do I feel fine for a week, then awful for a week?
Because your hormones are fluctuating.
Yeah, we've talked extensively about that. Is rage or irritability a real symptom, or am I just losing patience?
100%. It's usually a symptom of low progesterone.
And I would just want to say, like, if you're feeling it, then it is real.
And I will also say one thing that we haven't talked about that one tiny little snippet is the nervous system regulation. I think of it like our cave woman running from saber-toothed tigers. The culture that we live in right now is like stress on stress on stress on stress on stress. Yep. And stress also feels like irritability, rage, snappy. You're literally in fight or flight. So everything looks like a saber-toothed tiger, including your husband and your children and the coworker. So progesterone, but also there is a long conversation here about nervous system regulation. And the more that we add, like, also I want to be skinny, so I'm under eating and over exercising, and I can't sleep at night, and my hormones are trashed, and my parents are ailing. Like, it is such a setup for like nervous system dysregulation, which feels like snappy, can't lose weight, can't sleep. It's a whole different conversation, but that it's not just progesterone.
Yeah, I love that. Thank you. Is anxiety a common first sign?
Yeah.
Yeah. Especially, I would assume, for someone who hasn't experienced anxiety.
Yeah. And oftentimes what I hear is like, I'm overall anxious out of nowhere. Like, I don't even completely know what I'm anxious about, but it's very often cyclic. So 2 weeks out of the month, I'm less anxious. 2 weeks out of the month, I'm way more anxious. That's progesterone. That we can fix that easily.
What if I am on an antidepressant, but it stopped working the same way?
I would still look at where those symptoms are occurring. If it's cyclic, it could be hormonal more than that. Now, as Tia can comment, like, sometimes you have to change antidepressants, and sometimes life circumstances change. And if you're not sleeping, your depression's going to get worse, and other things like that.
Yeah,
sleeping fundamental. Yeah. Absolutely. I think that's where a good referral partner makes sure collaborative care is taking place, because it may be one versus the other versus both. And fun fact, one of the screening tools for anxiety, that's one of the questions it screens for, is the irritability piece. So it's overlapping with so many different diagnoses or different things. But absolutely, like you said, if you're feeling it is real, and what's the cause of it? There can be so many, but you got to kind of trace it back, figure that out.
Can birth control mask perimenopause symptoms?
It does mask perimenopause because it is hormones. Now, it can cause its own funny little not good things, but yeah, it is estrogen and progestin, so it will stop your ovaries from doing their natural transition, which is not always as bad as it sounds, but yes, it will mask. You won't know what's going on underneath.
If you don't, then will other symptoms arise?
Sometimes, yeah. So if someone's using a birth control pill for contraception, then we can sometimes add progesterone or estrogen or testosterone to it. It gets a little nuanced, but yeah, you can still, it can go either way. You might be perfectly stable through the perimenopausal transition on a pill, or you might be on a pill and still feel like, I think something's still happening there.
Last one. When is it urgent to get help for mood changes?
I think it's a matter of, number one, any time is okay to get help. It does not have to be severe. You don't have to feel like your life is a mess before you get help. Sometimes I get people who are like, it's not that bad. Like, who cares? You don't want to feel this way. Let's fix it. Like, you don't have to reach a certain crisis level. On the flip side of that, think about your function. Once it's affecting your function, you got to get help. So if it's affecting the quality of your marriage, if it's causing you problems at work, if it's causing you problems with your kids, like you're having to repair the relationship constantly because you're not in the right headspace to fix it, if it's getting in the way of your sleep, if you can't go do the things that you wanted to do because you're so tired and so emotionally tired. That's one of the things I hear. I get home from work and I've got nothing left for anyone. That's not fatigue always. That's emotional fatigue. That's affecting, like, I was going to go out with friends, but I just couldn't. That's the right time to get help. Yeah. And certainly anything worse than that.
For sure.
Yeah.
I love that distinction, but I also love the call to say, hey, any symptom is a reason
you
to
just
go.
deserve to feel great.
Yeah. Especially, and my wife's been the first one to point out, so you just get to just live it and like be parent, be coworker, and just do it. So it can be very frustrating. Like if that's you, like for sure, like that is a sign to me personally that like you should.
If you're sick of it, yeah. I'll say too, I get some patients sometimes who will come in and say, these are my symptoms. I think it could be hormonal. And by the end of the conversation, we're both in agreement that this could be hormonal, but they're not quite wanting to start hormone replacement therapy or anything else first. That's totally okay. Sometimes people will be like, I hear what you're saying and I'm more informed now. Like I understand what's going on. I want to track it. I'm not quite ready to add anything. And sometimes that's the great first step, is just talking to someone to be clear and understanding.
Yeah.
Doesn't mean if you go to the doctor that you have to take something or you have to do something.
Sure. I want to thank you, Dr. Cracroft, for, enlightening me so much, but just for the work that you do for women in general, for the population of Utah, for our listeners. I hope that they get something so great out of that conversation. There's plenty to grab onto.
Thank you. This has been a really good conversation.
Yeah.
It's a fun twist. Usually we talk a lot about hormones and HRT. People have so many questions about HRT, which I love, but this is the stuff that really gets me excited to talk about. So it's great.
Where can people go to learn more about you, your care that you provide, Uplift for Her?
Yeah, everything's Uplift for Her. So we're on Instagram, we're kind of on Facebook, and then our website is Uplift for Her. I have a podcast, Uplift for Her, where we talk more about these things. So any of those places.
If you're listening to this podcast and you're into podcasts, you have a whole library of conversations you've had around these topics. So please.
It's 10 out of 10.
Oh, thank you. Thanks. It's pretty fun.
And if you want to know more about mental health care and treatment options that could be available to you, you could always visit anewtherapyutah.com and see providers like Tia, who are amazing and really want to look out for you. So thank you again for this conversation, and I hope we get to talk again sometime.
Oh, me too. I'd love that.
But thanks.
Thanks.